in terms of the impact niche has had, and we have seen great reductions of malnutrition through this program. Actually, for a pilot county like Kitui, where it was piloted, their malnutrition rates came down from 46 to 26% in 2014. And that notwithstanding, there is something I always ask the nutritionist, Laura and my colleague. How much of the nutrition information is going out to us as Kenyan citizens? Because I'm sure if you told Kenyans that by giving their children good nutrition, the cognitive development of their children will be superb, I'm sure all of us are parents. No parent wants to have a child who is struggling in school. And I think that is how we need to break it down, such that when we are talking of malnutrition, we are telling the community how it affects them at that personal level.
That let's work very close together with the two departments, nutrition department and also the child protection going forward, because the program comes through national government, but if we work closely together, the county government being on the ground will be able to ground the activities, and by the end of the day, all of our Kenyans, the communities, the children, and expectant and lactating mothers will benefit more.
Also mentioning the USAID withdraw from us, it will really affect us. And this is where we are really welcoming you to come in handy and support the programs which are already there. We have some strategies and plans around the county, including the budget, and also some others that we've borrowed and developed with the USAID. For example, the graduation model, which really addresses the issue of social protection fully, that the county we are approaching it, not the malnutrition aspect, but the root cause. Also there, the county is growing. The urbanization, it's also an aspect that is affecting that area. I'm so happy because we are targeting the CHPs. Those are the people who really understands our community and knows what is necessary.
So we have a lot of challenges in terms of the water quality. We've done so many boreholes, others are dry, others are saline. In some areas where we, like in Merti, the Cherab zone, right now we are doing water tracking for the last 1 year. There is a place called Resabaru.
So we thank UNICEF because it brings us together, and we ask each county to put some commitments. For Isiolo, we had a meeting and we made a commitment. We are going to put around 137 million for social protection, most of it for ECD, maybe establishing even a rescue center for children or mothers who want to go to work. They can leave their children somewhere. So these are some of the areas that I think we are going to collaborate. The other issue that we have been doing is on the issue of malnutrition in Isiolo. It has been a big concern, and we have been having a platform we call Multisectoral Platform for Nutrition, which has been working in this county, collaboration of the national government, county, and the partners. And we have been able to lobby even for employment of nutritionists at the hospital. So we have quite a number of nutritionists who have been employed to try to bring that that capacity building in place, because before I think the county was having like only one or two nutritionists, but as we speak I think the CC for Erod will attest that the number has increased. I don't know the actual number, but it has increased in that line. So going forward, I think in this partnership we will see what we can also put it in the kitty, because of course we have brought something in terms of the money which will go to our people. I don't know for how many years, but now going to the next planning cycle, we will also see it and see as a county what else can we also bring in, so that it is not seen as if the money is only coming from one direction.
So in this case, our county has improved somehow, because when we came in 2022, our global acute malnutrition rate was above 20. But by 2023, it had come down to 15.4. And 2024, we did another survey. It was at around 13.7. That's the GAM rates. So, but the fluctuations are possible because of so many factors, whereby you find that there is rural-urban migration. When somebody comes to the cities, they are not able to provide as much. The challenges are many, and this year we are fearful also because we are also dependent on rain, which were depressed. So somehow we don't know the impact of the depressed rain, because somehow when the animals, because we are pastoralists, when the animals move away from the villages, the mothers and the children are affected because they don't have the daily supply of milk.
Primarily, the traditional approach of implementation of addressing malnutrition has actually been, what we will call pillar or single pillars, where you find a sector is moving in to respond to issues, while the problem that they are responding to is actually multisectoral, in the sense that it requires a concerted effort from all the the players. And what Niche is actually doing, and we keep on urging government, both at the national and the counties, is that the ingenuity that Niche is bringing is the fact that it brings that multisectorality in responding.
Niche is a program that is coming to intervene in terms of improvement of nutrition status of our children through cash transfers and health education. So this is targeting 6 counties from northern Kenya. It's a second phase because there are other counties, around 5 counties that were actually piloted, and we have seen success stories. And it's targeting improvement of nutrition status of children, health education. There is also the aspect of positive parenting to ensure that the child is brought up holistically. This is important specifically because the child below the ages of 36 months requires a good nutrition upbringing.